Good afternoon, and thank you for joining us for this Virginia Tech panel discussion. Today we have invited several experts to help answer the many questions that have been coming into Virginia Tech as it pertains to vaccinations and, more importantly, the return of the fall 2021 semester. It's really an opportunity for you to hear directly from them about many of the questions that you've been emailing or calling about. And I'd like to introduce our panelists, actually. Dr. Molly Odell, adjunct professor in the Department of Population Health Sciences at Virginia Tech. Sorry, I'm going to come back to you, Molly. Mike, you are right next to me. Let me start with you. Mike Mulhare, who is the Emergency Management Director, President here at Virginia Tech. Dr. Molly Odell, adjunct professor in the Department of Population Health Sciences at Virginia Tech, as well as adjunct professor at Virginia Tech Carilion School of Medicine. Dr. Odell also initiated the pandemic response for the Roanoke-Allegheny Health District. Welcome to you as well. Dr. Frank Shushak, Vice President for Student Affairs. Dr. Laura Hungerford, Department Head and Professor of Population Health Sciences, and Dr. Dean Learman, Dean of the Virginia Tech Carilion School of Medicine. Thank you, all of you, for joining us today. You know, I know that many of you are getting these questions as well as the ones that are coming into the university. Mike, if I can start with you, the university has said that it wants to return to as normal of a fall semester as possible, and really the key to that is vaccination. In that vein, Virginia Tech announced a month or so ago a mandate for vaccinations for students, as well as recommending that employees get vaccinated and upload their vaccination cards as proof. Can you tell us today where things stand with that, what the numbers look like in terms of the response?
Sure, I'd be glad to. So we updated our dashboard on Monday, and I believe the numbers showed somewhere around 57% of employees, both faculty and staff, have submitted their registration cards, and I think we were somewhere around, Frank, was about 36% of students, and our expectation is those student registration cards will continue to roll in through the next few weeks. So we're on track. We're not quite there yet, but we seem to be making good progress, and we hope that progress continues.
I want to ask you, and I know we've addressed it before, but the questions are still being asked, so I want to make sure people understand. Why is there a mandate for students but not faculty? A lot of folks expect or think that it should be both.
Sure, and that's actually a great question, and I think in a perfect world, you know, there would be a requirement for employees as well as students, but there are other factors involved in that decision making, and at this point, the university was not in a position to make that requirement of employees. Now, so that situation could change, and perhaps at some time we will have to revise that decision and make a change. But right now, this is where we are, you know, with the requirement for students, and really an expectation, I think, for our employees to be vaccinated. And as you can see, the numbers are supporting that right now. And again, hopefully that will continue. But again, the overall goal is to have the greatest percentage of our population, whether they're faculty, staff, or students, vaccinated by the time we begin the semester in the fall.
I know you said the numbers are rolling in, and you expect that to continue in terms of people uploading their documentation of getting vaccinated. August 6th for students, August 15th for employees. I wanted to ask you about the importance of doing that sooner than later. Like, what's the purpose of getting that information? Are you using that as it comes in to devise plans, to plan for the fall and what that looked like? How are you using that information?
Sure. We would urge anybody who's already been vaccinated and who has not submitted their registration to do so as soon as they can, because it's absolutely an important tool in us determining what mitigation strategies we may need to do come the fall semester. So yes, we urge everybody to get that information, and it does impact our planning for what we can do in the fall.
Dr. Shushak, I wanted to turn to you and just ask, what happens to students who don't comply with that mandate by uploading their proof of vaccination after getting their vaccination, of course?
Thanks, Dawn. It's a really important question because the consequences are significant. It's important that students know that if they don't upload their vaccination verification by August 6th, then we will begin the process of disenrolling them from the fall classes. So they'll actually be removed from their classes. So that's as significant as can be. So we need students to do that. sooner rather than later. Another important thing is for our students that live in the residence halls, you won't be able to move into a residence hall if you haven't uploaded your vaccination requirements. And of course, that's earlier than classes begin. So to Mike's point, it's incredibly important that people go ahead and upload their vaccination verification so that we can get those things cleared up to make sure people are ready to go for the fall semester. The good news, like Mike said, we've already had over 11,000 students who have done that, so we're quite pleased with how that's going. And also to Mike's point, I think a lot of our faculty have already done that as well. We're pushing 60% of our faculty and staff have uploaded their vaccination verification. So I think this is good news for Virginia Tech, and we're feeling optimistic about that.
Dr. Odell, if I can ask you, we were talking about the percentages of people who have done so far. And people like numbers. It gives them perspective, I imagine. But can you talk about what a good number is in terms of vaccination? Not necessarily a specific number, but what are the milestones? How much is good enough?
Well, the first thing is to outdo the state. And we're getting close to that on this campus, which is wonderful. And for me, my first ballpark of breathing easier would be around 75%. If we could get 75% of our population vaccinated, I would certainly feel more comfortable than, say, the 51% that we are statewide right now.
What's the impact of that smaller number of people who are unvaccinated? What impact does that have on the greater population?
Right. So the decision to get vaccinated is, first of all, a personal one, a medical decision for oneself. But besides that, it is a decision of citizenship, because what's important about all vaccinations is it creates a impermeable barrier to whatever the pathogen is, the bug, to not be able to get the vulnerable people in the population who cannot be vaccinated for some reason or another. And right now we've got lots of children who cannot be vaccinated because there is no vaccine, as well as other health and other reasons. Plus, no vaccine is 100%. So the reference to the term herd immunity is that citizen bandwidth of protection around the whole community. And that's what we really want, besides the individual's protection.
I'm going to come back to you and touch more on that, but I wanted to bring in our other health experts here. And Dean Learman, if I can talk to you, we're all familiar with the Delta variant that is in the news, that's top of mind for a lot of people. What's the concern, the biggest concern over vaccinations or being unvaccinated, particularly as it pertains to the Delta variant?
A lot of folks are worried about the Delta variant, and rightfully so. I'm just remembering that those of us who were vaccinated early because we were taking care of patients based upon early emergency use authorization, with all the approval data in place, we just didn't know how it was going to go after that vaccination. We had confidence it was important, but we weren't sure how robust it would be, as the virus does what viruses do and create a bunch of different variants. Over time, we've learned, fortunately, that the vaccinations, no matter which they are, hold up really well in terms of demonstrating effectiveness against the variants, including the Delta variant. So that's sort of the good news story. We didn't know this in advance, but it's one of the real positive stories that come out of the vaccination sequences that we've been through. Unfortunately, the Delta variant is more infectious than the wild form of SARS-CoV-2. And therefore, for those that are not vaccinated, it spreads faster. And in communities that have low vaccination rates, more of those exposed folks are not going to be immune to the variant. And so it's going to spread faster, and it's going to cause a disproportionate burden of hospitalization and death among unvaccinated folks. And this has been shown throughout the world, as well as in regions of the United States and in regions within states that have low vaccination rates. So even at our modest 51% total vaccination, I guess it's like 59% first vaccination, incomplete vaccination, even there we see a difference in Virginia between communities that have that level or above in terms of vaccination rates and those communities that have lower vaccination rates. The Delta variant is sort of like the normal form of the virus on steroids,
Right.
as it rips through communities that have low vaccination rates. So everyone who's worried about it should very much be worried, but with reassurance that the vaccination will protect them.
Dr. Adele, if I can ask you, what does that mean for us in Southwest Virginia in terms of the Delta variant? Is it here?
It is. And in fact, Southwest Virginia has the highest number of the variants. There's alpha, beta, gamma, and delta. And we have the highest number of variants in Southwest Virginia compared to the other regions in the state. So we have concerns because our vaccination rates in Southwest Virginia are lower than, say, Northern Virginia.
How do you counter that?
I think this is a great thing, and people understanding what the consequences of the Delta variant are in our community, because all that virus wants to do is replicate, and it's going to find the unvaccinated in order to do that.
Dr. Hungerford, I wanted to ask you about, we're talking about the Southwest Virginia community, but what about the Virginia Tech community in terms of the importance of getting vaccination? You're public health expert, a faculty member as well. Can you give us some perspective on that and how this impacts the Virginia Tech community?
Well, that's a great question, Dawn. And if you think about what happened last year, people were so concerned about our community, what happens when the students come back. And in fact, our incidence went down when students came back because they were careful, they adopted masks, they did all sorts of great things that helped stop the spread of disease. And we didn't have transmission in classrooms, even the ones where we came together with students. So I think students coming back and being a part of our community really adopted things to be able to help us control and to model that. I mean, they're the future generation, and they made really good choices about what to do. The same thing now with students coming back. They're all required to be vaccinated. So before they made choices to wear good masks and distance, now because of this program, they're going to be vaccinated potentially at a higher rate than faculty, hopefully not, but for sure our surrounding community. So once again, they're a really positive influence as they come back. And that means it's going to be safe to teach face-to-face in a classroom. Not only do we have the choice to be vaccinated, and hopefully we rise to the challenge as faculty and staff to be vaccinated at the rate that our students are, close to 100%, but even without that, the students in the classrooms will be vaccinated. And so we'll be teaching in a situation where the risk is the lowest that it can be. I think, and Mike could probably speak to this, even when we had cases on campus, a lot of them came from outside of campus. Mm-hmm. And interactions that our students had, and then maybe spread it to a roommate. But it was a lot of the interactions outside. Students who did get sick were careful to try not to spread it and have community spread. So I think when we think about what the fall is going to look like, with all the students vaccinated, faculty having the choice, and employees having the choice to be vaccinated and making that choice, we'll be back in a situation that's safe. In fact, people have been talking about keeping their masks mostly because of things we're not vaccinated against and other kinds of colds, and that if people are sneezing or coughing in the classroom, hopefully we will use masks. Right. So that we don't have those other kinds of problems.
That's really important to note, because there are a lot of folks who are still concerned about people who may be unvaccinated within their spaces. Mike, I don't know if you can touch on that. What about those people? What do you say to the folks who have made the choice to get vaccinated but worry about someone else in their class, in their lab, at an activity that may not be vaccinated?
Sure, and I'll ask the other folks on the panel to weigh in as well. It's the best way to protect yourself individually is to be vaccinated. That's the first step you can do. And we will require other mitigation steps as well. For instance, we just recently announced that if you are not vaccinated and if you're in an inside space, you will be required to wear a face covering to minimize that risk. But again, the answer to the quiz is really to be vaccinated. And the more people we get vaccinated, the less there's less risk for the scenario you just described.
I would say that future is now, and we're seeing this because of our 12-month curriculum in the medical school. We're seeing as our classes return and advance and faculty or staff are back in the buildings, with mostly unmasked encounters in our classrooms and small group spaces, and a few folks wearing a mask for a variety of reasons. It's a magical thing to watch experiential learning back as it should be. It brings such joy to folks to be able to take advantage of that, and so that's the goal, right? The goal is to really come back to that high quality, high value experience that many of our students at Virginia Tech come here for, whether they're undergraduate students, graduate or professional students, and it's within reach. It's within reach. It's going to happen, and we just want to make it as safe as we can for everyone.
And you mentioned folks being required to wear masks if they're not vaccinated, but how do you hold folks accountable for that?
It's not easy, and there's really, it's not something we'll be policing. But again, certainly the expectations are the requirement, but if we do know that somebody's not vaccinated, or it comes up in a conversation, certainly somebody can ask that question, somebody does not need to answer that question, but if there's individuals who are known to be not vaccinated, they can certainly be asked to wear face coverings.
Frank, I'm wondering if you can touch on that too, especially with such an emphasis that Student Affairs puts on wellness, health and well-being, about the importance of wearing masks and students doing the right thing if they're not vaccinated, but also this idea of really normalizing wearing masks and it being okay. For example, I have a child who's not fully vaccinated yet, so
Right.
I still choose to wear a mask. You never know what reasons people who are vaccinated even may still wear a mask.
We sure want to support everybody who wants to do whatever they can to protect themselves and those that they love. And I think one of the most beautiful things about a place like Virginia Tech is we are a community, and we often talk about we're in a congregate setting. 10,000 students live in the campus residence halls, and one special thing is that we have 4 faculty members called faculty principals that live in the residence halls that have weekly events in their home. 3 of those 4 faculty members have families and kids under 12. They can't be vaccinated. So that's just an example of the variety of people for a variety of reasons. Maybe they have an illness that doesn't allow them to be vaccinated. Maybe they're under 12 and they can't be vaccinated. Maybe they are protecting themselves from another something that is going on. Those are all reasons just to extend people grace and assume that people are doing the best that they can. But I think the important thing is, how do we vote for other people? I mean, that public health really is, how do we care for the whole? I know we have individual rights, but how do we exercise our own rights, but also vote for the well-being of the whole? And in so much, that's what ut prosim is, that I may serve, is how do we serve the well-being of the whole? And that's what we got to choose over and over again, is how do we take care of all of us? Because that's what's going to allow us to have a great fall semester. We know what a year was like without all the things that we love, and how it impacted our well-being, how it impacted people's mental health, how it impacted people's learning. So getting vaccinated, if you can, and we need you to do that, is the most important thing that you can do for the community.
I was going to ask you if you have recommendations for what people can do individually to make a difference and to help us get through this, basically. Dr. Hungerford, the COVID Crushers, part of your team, they do a lot to help our community. It's really hard to keep up with them, actually. Can you talk about some of the things that COVID Crushers are doing? Tell us about them, about that group of students, and what they're doing.
So the COVID Crushers originally started as a group of students from the graduate and undergraduate public health program doing peer-to-peer modeling and figuring out how do you spread the message that you should be wearing a mask and how do you make it easy for people to do. And they were heavily supported by the New River Valley Task Force that funded a lot of their efforts and helped them. And so they had booths downtown and they handed out masks and hand sanitizer and modeled wearing masks and did that there, but they also helped at elections and all sorts of places where they could show people how to wear masks, that masks are fun, and hand them out and work with our community. Currently, they've switched to really helping with the vaccination effort. And so last summer we had a competition at Virginia Tech that looked at the best student projects to help change the tide and really make a difference. And one of those, there were a bunch that were amazing. One of those was the COVID car that was set up to be able to go and help test people. Well, that's switched, and the COVID car now is helping vaccinate people. And so it's been at work sites, it's gone to individual congregate housing locations, any place where people can be vaccinated, including public parks, like at Clater Lake. They have one coming up, where wherever people are, just to make it really easy for them to be vaccinated. And people, a lot of people are getting vaccinated. They're not that they don't want to, it's more that it wasn't convenient. And if you're there with your family and they're all over 12, you can all get vaccinated at once on your vacation. So they've been working in that kind of area.
I was going to ask what the impact of doing that, sort of meeting people where they are, quite literally, by taking the car out to locations.
It's been huge. It's been huge. And they've looked at higher risk populations that may have trouble because of their work schedules getting to places to be vaccinated, and had, hundreds of people vaccinated, every week because of this.
It's a great example of making the right thing easy.
Exactly.
Yeah.
Just to add to that, for our employees and students on campus, we're running a series of vaccination clinics and opportunities. I think the first one's tomorrow over at the HR on Turner Street. So there's opportunity to get vaccinated right here. And, we urge everybody to take advantage of that for those who have not been vaccinated.
I'm curious, will that continue as the semester goes on, or will students have to go elsewhere?
We will continue it as long as there's a need.
It's interesting. Dr. Odell mentioned the aspirational goal for herd immunity, and I was thinking about how all of these programs, we're talking about the mass vaccination programs, then meeting people where they are, making it easy and convenient to do the right thing, how far that's going to get us toward that goal from where we are now. And although it sounds less efficient, I think to get us those final steps of the way, we're just going to have to really be good friends and neighbors and listen to meet people where they are, not only with the conveniences of vaccination, but to understand without judging them what are their concerns, and being able to show a lot of compassion for them. Although I agree with what everyone's been saying about the social contract that we have in our community, the fact that the folks that got vaccinated enabled states to open up their economies, enabled everyone to enjoy more freedoms. That's what vaccinated folks did to support their communities. I completely agree with that, but I would say that when it comes down to the individuals that are resistant, if they feel comfortable sharing the source of their resistance to someone who they feel is really trying to be there for them without another agenda, they're more likely to ask the questions they really need to ask, want to ask. We can answer those or put them in touch with folks that can answer them, and then have out back someone to vaccinate them right now, should they be interested in doing that. And so moving from these larger initiatives down to those one-on-one initiatives is probably going to be what we need to do to get us all of the way there. I think for a while I was hoping, I don't know if you guys were, that the credible spokesperson would do it. Someone who's just like me, but who is famous or who I respect for a variety of reasons. We just put them in front of a camera for public service announcement and explain why they're doing it. Well, that happened, and a lot of people responded to that too. But we still have this core of vaccine resistance, and I think it's because of just trying to get people the information they really want and need to make a good decision.
Well, and we showed last year how important masks and social distancing are and what a big effect they can have. So I think, when the pandemic started, we had local groups making masks because we didn't have them. Now we all have our whole collection of masks that have different statements for different occasions. I've even seen children who have them coordinated with their outfits. And so I think if we always carry masks with us and make it comfortable for people to say, I'm not vaccinated for whatever reason, yes, I'll wear a mask, you can wear a mask, and we can support them kind of by that. That's another way that we know is really effective in stopping spread. So carrying some of our collection of masks, I think, is really important too.
We were talking about the folks who are unvaccinated being required to wear masks. I'm wondering, there's another element to the requirements for being unvaccinated, the masks, and also testing. So folks who are unvaccinated will have to be a part of the testing program. Can you talk about what that looks like and what that means and
Sure.
how often?
Sure. So our goal is for anybody who's not vaccinated, they will be required to participate in a testing program here at Virginia Tech. We're in the process of developing that program, and really the objective is to test those who are not vaccinated as often as possible. So what we're working on now is determining what's our capacity for testing, what's our population that's not vaccinated, and then we will develop a frequency of how often those individuals, whether it's students, staff, or faculty, will have to be tested. Our objective is to do that at least weekly.
And that's important because the burden is not zero in our area. You know, our burden is still relatively significant. It's not high like it was last summer, but it's not low either. So there is disease circulating, and we know Delta's in the region, and that will be magnified over time. So it's very important that we identify, particularly the asymptomatic cases that may present themselves.
Will the Delta variant have less impact than what we saw in the fall before people were vaccinated?
No, we're not, because as Dr. Learman said, it's more infectious, it's spreading easier.
Right.
It's still causing disease. And just like the wild variant and the alpha variant, the UK variant, some people are still getting asymptomatic disease, but some people are still getting mild illness, and some people are being hospitalized. So the whole spectrum of disease is being manifest with Delta, just like with the other variants.
I would just say that we think about health disparities in traditional ways in public health and in medical education too, around folks that don't have access to care and therefore suffer worse outcomes as a result of disparities. This is a disparity, as Dr. Adele was saying, that is coming from vaccinated versus non. For vaccinated folks, we're never going back to what it was like before. But for unvaccinated, it could even be worse if you look at just the unvaccinated group, how many become infected, how quickly they become infected within that unvaccinated part of the community. That could well be worse, creating even greater disparities between vaccinated and unvaccinated that we see now.
And I think that's part of the fear that some folks have with people who are unvaccinated and the impact that they worry knowing that there's a variant out there that is more, what's the word that you use that's like the super, I can't recall how you referred to it, but yeah, that's more powerful. And I think that's part of the concern with some of the folks who are worried about the impact it will have on them.
And it's never the wrong thing to wear a mask, socially distance, and wash your hands. I mean, that, I hope everyone will remember that for the rest of their lives. That's always a good way to prevent the spread of illness.
How many folks missed their annual colds and flu?
Great.
That's a really good point.
Hey, Dawn, I wanted to go back to something Dean Learman said about helping people who have specific concerns that need to be addressed. And as I'm thinking about the number of emails that I've received in the last month, it all comes down to, a bulk of it comes down to this question about is getting COVID or the vaccination safer? Which one is safer? So I hear that question all the time. So while we have all these public health experts here, I was wondering, could you address that question one more time for people so that they could hear that?
Everyone's trying to mitigate risk, and
Yes.
you're trying to figure out which is riskier, getting it or having
So
a...
except for some specific individuals, it's clear that at this time, getting the COVID vaccine is recommended over not getting the COVID vaccine. And that goes for all the special incidences that have shown up with myocarditis and Guillain-Barré syndrome with the J&J vaccine. The recommendation is still that the risk from COVID outweighs any risk from any of our approved vaccines.
Two follow-ups to that. One, I'm sorry, I forgot my question. The myocarditis, that is something that impacts that has the potential to impact people in our community because of the age group that they've talked about.
Right.
That impacting. Can you talk about that and where that stands? I know that last time many of us gathered, we talked about the Centers for Disease Control having an emergency meeting to talk about it. Where did that land after having that discussion in terms of
there is
risk?
evidence that a small percentage of recipients of the mRNA vaccines, that's the Moderna and the Pfizer vaccine, mostly males, young males, have had mild cases of myocarditis, an inflammatory condition of the lining around the heart. But the recommendation is still that the benefits of the vaccine far outweigh the risks. And of course, people in that age group can have a non-mRNA vaccine, and that's the J&J vaccine. The J&J vaccine has been shown in a very, very small percentage of older gentlemen to be associated with Guillain-Barré syndrome, which is a neurological disease. And again, the J&J vaccine, FDA, CDC have put out a joint statement that it is much more advisable to get the vaccine than it is to, the risk of getting the vaccine is far less than any risk of getting the vaccine.
The other question that I wrote down so I wouldn't forget it again is what about when you were talking about the importance of getting it and the risk, what about individuals who have had COVID, what the recommendation is? Because some have said, well, I've had COVID, I don't need a vaccination.
And it's true that they have some antibodies, but the evidence to date is that the protection is more robust if they also get fully vaccinated. I don't know if you can add anything more.
Yes,
That.
exactly. The idea is that the boosted immune response that comes from the vaccination is hypothetically expected to last longer and be more robust. One of the things that worries people about weighing benefits and harms is the emergency use authorization, that there's something that we don't understand yet. Contrasting this with other approved vaccinations, sometimes we see these same sorts of increases in risk that are very, very small that occur after final approval. So my understanding is, and I'd love to hear if the other panelists have inside information, is that the FDA has hesitated to approve the vaccines not because of safety data, but because of shelf stability. That max vaccination events, that's easy because they know that it's going to be used while it's still safe to use and effective in terms of refrigeration and storage. It's not yet been sorted out how it's going to work in thousands and thousands of offices where this is going to be administered.
And across the world.
And across the world. So that, when I learned that, I said, oh, well, so they have all the safety data. They're not waiting for anything else, except in the younger age groups as those get implemented for vaccine eligibility. But for the rest of folks, there's nothing to be waiting for in terms of safety data. It's there. It's just a matter of shelf stability. I don't know if you've all heard similar or
Yes,
different.
that's excellent information.
Just a comment on vaccinated versus getting COVID, having the privilege of having both. The path of getting a vaccination is much easier than having the illness. I can certainly recall walking down to my driveway to get the mail and looking at that hill and not necessarily having the breath I probably needed to walk back up that hill when I certainly had COVID. So, I don't recommend doing both, but I certainly recommend getting the vaccine if you have the opportunity, because getting the disease is not a pleasant experience.
Yeah. Well, we're glad you've recovered
Well, I
and
appreciate that. Thanks.
cycling now as well.
And I think we often don't, when people think about, I'm worried about those potential complications of the vaccine, they're not contrasting them to how many people get sick and die and the severity of long COVID or any of those things that you're taking as your gamble. That's much worse than this tiny, tiny chance that one of these other effects would happen. And so it's kind of like if you wait and get COVID, it's almost, you're going to, have a much higher probability of having some complication like this.
Plus, you'll pass it on to somebody else.
Exactly.
I think that's really important.
Well, that's what we got to remember, right, is that you just plow through an incident of COVID, but you may give it to someone where it literally is life and death, and that is so important to remember.
Yeah, it's interesting to try to compare all the numbers here. I heard a statistic this morning that if the trajectory of COVID infection and death had continued in the United States as it was on the trajectory before vaccinations, there would have been 280,000 more lives lost by now.
Heard that.
Versus the Guillain-Barré phenomenon with the Johnson & Johnson vaccine, the baseline rate in the country per year is about 10 per million people will get Guillain-Barré. And I think they said the risk was elevated to, say, 3 times that amount. So now you've got 30 people per million who are vaccinated getting Guillain-Barré. But I have to do the math, the other 997,000 didn't get it and have been protected against being one of the 280,000 that are dying from COVID.
I think it's really important that, Dr. Odell, you were talking about recommendations for getting which specific vaccine. When we first started, it was get whichever one was available to you, which has its merits. But I'm curious if it's important for folks to speak to their health officials or speak to someone that they trust to your point, Dr. Lehrman, get those questions answered, because maybe they can work through some of that by a decision about which vaccine would be best for them.
That's right. That's exactly right. And, one of the complexities with this whole pandemic has been doctors' offices have been slammed. And not every patient had access to their trusted primary care physician. And so that's complicated the, triaging all the information for each individual who wanted to know, how is this going to affect me? Now we've got a little bit more of a pause, and it's a good time to circle the wagon and figure out if, somebody is still not vaccinated, to think through exactly what it is they need reassurance on or direction in from their provider's office.
Okay. As we begin to wrap up, I wanted to give you a chance, Frank, to talk about, we've said that we'd like to have as normal an in-person experience for the semester as possible. And I'm wondering if you can talk about some of the things that will be happening on campus that are normal, what we'd normally expect. The activities and events.
Sure. I just finished an article about kind of the erosion of friendship in American culture and the impact of relationships and friendships because of COVID-19 in this past year, what we've suffered. What I'm hopeful for is, as we come back to campus and we have in-person learning and we gather around dining tables and we gather around people's apartments, that faculty principals host events in residence halls, that the learning will turn right back up, that the friendships and relationships will begin to build. I think that's what the Virginia Tech experience has been known for, and a Virginia Tech hands-on education, what that looks like. We know how experiential, how relational learning is. And so when we say we want a normal fall, we want to come back to those kinds of experiences that accelerate our learning, that give us life and fullness and richness. Those are all things that we love about a Virginia Tech education. We're really close to being able to do that. And so that's what we're hoping for the fall, is a return to that powerful kind of education that we all love. And that just means that we all have to get in and do our part, whatever we can, for the better of everyone, so that we can get back to doing what we do best.
And I just wanted to give each of you an opportunity to share some final thoughts or something that's important takeaway for our audience to hear. Dr. Lieberman, I'll start with you.
I've been thinking about what to say on this one. I think the discussion's been so robust. We've covered so many important points. I guess I'll focus on how folks that are concerned about vaccination can find a trusted source of information. And I'll speak from the perspective of a physician or healthcare provider, in which this is a hallowed space. When that door closes and we're talking to our patient, they can tell us anything. They can ask any question. And we have only one agenda, which is to help support their autonomy and their decision making. And this is just another example of that general thing that we do. So I would encourage folks that are concerned about the safety of the vaccinations, who are looking for a credible source of information, to trust their physician. If they have a physician who they already have a good relationship with, schedule a counseling visit to just talk about it. No obligation to be vaccinated, just to mention it. Or if you just happen to have an appointment coming up for another reason, you can do one of those "oh, by the way" questions that usually happens at the end when the hand's on the door. And so go ahead and do either of those things, and that trust is going to go a long way to helping you feel more comfortable, either in becoming vaccinated or knowing how to stay safe when you're not vaccinated.
Great, thank you. Dr. Hungerford?
I think, if we look at the situation now, I mean, we're sitting together, we're not wearing masks at this moment. We wouldn't be doing this a year ago. And so I think even for people who might not be convinced about vaccination, it's really easy to see what a big difference it's made in the hospitalization rates and the death rates. And we can even look at other countries where there's a shortage of vaccinations and see that they're not in this kind of situation now. So I think being a part of that, we've seen evidence now, even the people who were kind of like the wait and see, it's past time to wait and see. But I think at the same time, for people who can't be vaccinated, have children, other things, supporting mask wearing and modeling mask wearing and recognizing that that's going to be in our arsenal forever now is really important. And so thinking at that population level, how do we support each other? But vaccination and mask wearing are both big parts of that.
Thank you. Frank?
Dawn, I think I just want to say thank you to, if you're listening in, you're tuning in right now, it's because you care about Virginia Tech and you care about what Virginia Tech's role is in this community, and you're still listening, trying to discern how to help and how to be a part. I just want to say thank you for continuing to try to learn and try to make good decisions and support this great place that we call Virginia Tech. I know it has been a rough 18 months on all of us, and that making these kinds of decisions is hard, but thank you for voting for what's in the best interest of Virginia Tech, and we thank you for all the ways that you keep leaning into this community.
Thank you. Dr. O'Dell?
And I'll just say that I grew up with a buddy who I still hike with, and he had polio when we were children. He was 2 years older and was not eligible to get the vaccine when I did. And having gone, he was a patient of mine when I was in private practice, and we are still hiking buddies. And the impact of vaccine has always been obvious to me. This vaccine is the safest one that I've ever had. I remember starting to read about the Moderna vaccine. I was so excited about how they got into the vaccine business and followed it. And I have so much confidence in the technology. Not everybody can read those articles, I know, but that's an amazing thing that I feel so grateful for. And I just want everybody to remember that ever since the pandemic, everything we do either promotes the spread of this virus or it interferes with the spread of the virus. So let's all do whatever we can to prevent the spread of the virus.
Thank you. Mike?
Sure. I think I'd just like to elaborate a little on what Dr. O'Dell said, and I'll probably tell a story because the expertise clearly is over here. And first of all, full confession, and this won't come as a surprise to the panel when I tell them that I hear voices. And the voice I hear is really the voice of my grandfather, who grew up during the time of the Spanish flu. And I hear the voice of my dad, who grew up during the time of polio. And what I hear them telling me is that they would have loved to have lived in a time when the solution to those issues, to those disease, was right in front of them. And the solution is there. We have an opportunity to beat this. The answer to the quiz is there. And there's a need to get, to use the tool, and that tool is to become vaccinated. And the other piece I'd like to add is I think some of the concerns I hear is that people have concerns about what the vaccination is and some fear of that, and I hope the expertise here helped answer some of those. The other is I think there's a tendency that you can't tell me what to do. Mm-hmm. So if you're going to tell me I have to be vaccinated, then I'm not going to do that. And you know, in full disclosure, I don't necessarily like to be told what to do. You can ask me to do anything, but if you tell me what to do, I feel my back getting up a little bit. So I think my last comment would be, you know, we're not telling you, but I'm certainly asking you. And again, you know, for all the reasons we talked about, you know, for you know, the opportunity that's in front of us that has not existed in past generations to beat this type of disease. And I think we just need to take advantage of that.
Great, thank you. Thank all of you, Mike Mulhare, Dr. Molly Odell, Dr. Frank Schuschak, Dr. Laura Hungerford, Dr. and Dean Learman. Thank you for your perspective and really your expertise on helping make this understandable and answer all of the questions that people have been asking and continue to ask. Thank you for watching, and be sure to check vt.edu for any new information or any questions you might have. And you'll also be able to watch this recording at the same link once we've ended. Have a great afternoon.